Hello, my name is Robert Valenzuela. I'm a urologist in Washington Heights in New York City. Today we'll be discussing male stress urinary incontinence. Urinary incontinence is the inability to control the flow of urine. SUI refers to the leakage of urine that occurs during activities that exert pressure on the bladder, such as coughing, sneezing, or exercising. SUI in men most commonly results from uro-oncology treatments, including surgery on the bladder or prostate, as well as radiation. These treatments can damage the sphincter muscle or valve, leaving it too weak to function properly. Following cancerous prostate removal, urine leakage may also be referred to as post-prostatectomy incontinence. Studies have indicated that as many as 90% of men report leakage in the first few weeks following surgery after removal of the catheter. This is considered normal. In 5 to 20% of men, some degree of SUI will continue to be a significant problem following prostatectomy surgery, while continence returns in the majority of men. 6 to 9% of men undergo subsequent surgical treatment for post-prostatectomy incontinence following prostate cancer surgery. The prostate gland wraps around the urethra. This is the tube that runs through the penis from the bladder. Its natural structure causes many men undergoing a prostatectomy to experience post-surgery incontinence. Even nerve-sparing techniques can leave the tissue traumatized enough to induce temporary incontinence or even permanent problems with controlling the leakage of urine. Controlling the bladder or the storage vessel for urine becomes a problem because the sphincter muscle may be too weakened to work reliably after surgery. Normally, the sphincter acts like a valve that relaxes and opens when a person is urinating and closes when a person is not voiding. When the strength of the sphincter muscle is compromised, urine consequently leaks into the urethra. Leakage may be slight and occur only during pressure on the bladder, such as with a golf swing, a sneeze, or with a cough, or it may be so severe that it allows a virtual steady stream of urine from the bladder to soil the undergarments. It is not unusual that lack of bladder control is a problem for the first few months and up to 1 year following radical prostatectomy. Pelvic muscle exercises, or PME, along with other behavioral training prior to prostatectomy, may decrease the time it takes to regain continence after surgery. Less than 6% of men who routinely perform PMEs prior to surgery experience continual leakage 6 months after surgery. In a similar group of men studied who did not practice PMEs prior to surgery, almost 20% of men reported continual leakage. Contact your healthcare provider if you are experiencing symptoms of male SUI. If leakage persists more than 12 months after radical prostatectomy, an evaluation needs to be done to determine the exact cause of the leakage. Seek healthcare provider care if you have taken self-care measures for 2 months without relief. If you take medication that may cause urinary problems, see a healthcare provider for an adjustment on the medication. Let's discuss the diagnosis and tests for male urinary incontinence. The following is a basic list that may be done by your physician. This includes a medical history, a physical exam, a bladder diary, a pad test, blood testing, as well as cystoscopy, imaging techniques, and urodynamics to determine the exact cause of incontinence. Now let's move on to the treatment for male stress urinary incontinence. This involves non-surgical as well as minimally invasive interventions and surgical interventions. The non-surgical interventions involve pelvic muscle exercises, electrical stimulation, biofeedback, bladder training, as well as bladder management. The minimally invasive interventions include injection therapy, and the surgical interventions are the male sling and the artificial urinary sphincter. First, let's discuss minimally invasive treatment of male stress urinary incontinence. Injection therapy involves urethral bulking agents that are aimed at improving closure of the urethra in order to avoid more invasive procedures. You may hear such as Durasphere, coaptite, and macroplastique. The procedure can be performed in the doctor's office or in an outpatient hospital setting. The lack of success in all injections appeared to be due to the migration of injected material away from the sphincter area in months following the procedure. Next, we'll be discussing the male sling procedure. For men with mild to moderate SUI, a male sling procedure is considered a viable treatment alternative. Mild urinary incontinence is considered 1 to 2 pads per day, moderate is 3 to 5 pads per day, and severe greater than 5 pads per day. The best candidates for a male sling are men with no previous history of pelvic radiation therapy and men who have not had an artificial urinary sphincter placed. What happens at the time of surgery? The surgeon creates a support for the urethra by wrapping a strip of material around the urethra. The sling supports and compresses the urethra, similar to earlier generation devices. The surgery takes approximately less than an hour and can be done either as an outpatient or an inpatient procedure. The patient may be left with a catheter for approximately 24 hours. In a male sling procedure, the surgeon creates a support for the urethra by wrapping a strip of material around the urethra and attaching the ends of the strip to the pelvic bone. The sling keeps constant pressure on the urethra so that it does not open until the patient consciously releases the urine. The Coloplast Virtue Male Sling is a minimally invasive treatment designed for mild or severe stress urinary incontinence. This combines technologically advanced design, construction material, and surgical approach. Virtue offers potentially safer, more effective treatment solution than other male slings and possibly the artificial urinary sphincter. This sling elevates and compresses the urethra with 4 arms. No bone screws are used. The transobturator male sling, or the advanced male sling, is meant to restore bladder control for men with mild to moderate SUI, but works differently than the earlier generation bone-anchored sling. In this procedure, a small sling made of synthetic mesh is placed inside the body through 3 small incisions using no screws. The sling supports, but does not compress the urethra, thereby decreasing the potential for urethral erosion. Following the procedure, a catheter may also be left in place for approximately 24 hours. The artificial urinary sphincter, or the AUS. This is an implanted device that keeps the urethra closed until you are ready to urinate. It has been in use for more than 30 years. Some surgeons consider the AUS the gold standard, although it is more likely and must eventually be replaced because of its working parts. The AUS has 3 components: a cuff that helps close the urethra, a pump placed inside the scrotum, and a pressure regulating balloon which is placed in the lower abdomen. When a man wants to urinate, he gently squeezes the pump in the scrotum, which opens the cuff around the urethra. After 45 seconds, the fluid automatically returns to the cuff, allowing the cuff to close. After the device is tested during the surgery, the cuff is left in the locked open position. It is reactivated when postoperative swelling around the pump is gone. This usually takes approximately 4 to 6 weeks. In conclusion, while the loss of bladder control after prostate surgery may be a devastating complication which can have a significant negative impact on quality of life, men should feel encouraged by the increasing number of treatment options available to them. With appropriate evaluation and treatment, problems of stress urinary incontinence are usually treatable so that dignity and quality of life can be restored. Regardless of the treatment option selected, men should continue pelvic muscle exercises to optimize the degree of continence.